Good evening, everybody. My name is Dr. Hailey Axberg, and my husband, Dr. Ryan Hyde, and I are the owners and chiropractors at Glacier Family Chiropractic and Wellness, located in beautiful Columbia Falls, Montana. We are on a mission to empower our community, so you, to thrive through teaching you and helping you understand what it truly takes to be healthy and happy. And welcome to this week's weekly wellness workshop. Our topic today is one of my most favorite niche topics, and that is prenatal chiropractic, specifically the 3 P's of prenatal chiropractic. So we'll dive into that here momentarily. Before we dive into the topic though, I wanted to just take a moment to express why I love working with moms. I would say if I had to pick just one population to work with, it would probably be moms. I love working with kids and babies. I love working with all sorts of people. But I really love working with moms because more often than not, moms are the glue of their family. They are the person coordinating and taking care of everybody else and their schedules. They tend to pour from their cup even when it's empty, and I love to be the person to help them pour back into their own cup. And I just love working with parents in general because a lot of times parents feel selfish if they are investing in their own care and their own well-being, but I always let parents, mothers and dads alike, let them know that it's not selfish to take care of yourself. Not only can you show up better for your children when you are feeling better and functioning better and healing better, but that also sets the standards for what your kids see normal as they age and when they may become parents someday too. So I love working with moms. I love working with moms and the perinatal period specifically because I've always been kind of obsessed with pregnancy and babies and things along those lines, and it's really just a fulfilling time period to work with. I think a woman's body is really remarkable. It's incredible what we're capable of, and I love being able to support women in that journey. So my background in perinatal training started in chiropractic school. In chiropractic school, we all get just the basics when it comes to working with women who are expecting. I also chose to work with the staff doctor that I did while I was in school because I knew that I was going to get to see some prenatal patients and families. So had some background there, but post-grad is where a lot of my perinatal training came in. So I am Webster certified through the ICPA, which is essentially like the gold standard for prenatal chiropractic care. Webster technique is a specific chiropractic and analysis an adjustment that reduces nervous system stress. It balances pelvic bones and all of the soft tissues of the muscles and ligaments and things that attach to the mother's pelvis. And the goal is to improve the function of the mother's pelvis in pregnancy and in birth. So I also have some background in BirthFit. BirthFit is an organization that was founded by a chiropractor, and it is all about women's wellness, really focusing on preconception through postpartum. So we spend a lot of discussion and a lot of time studying appropriate movement practices and exercise, diet and nutrition, lifestyle tips, a lot of mindset work, breath work, things along those lines. So that's where my perinatal training comes in. I've worked with dozens and dozens of moms when it comes to the prenatal and postpartum period, and I'm not a mom yet, but hopefully will be in the somewhat near future. So now that you've got a little bit of an understanding of what my background is in perinatal training, we're going to start to dive into our topic a little bit. And before we get into the 3 Ps specifically, there are some, areas of concern in the birthing world in our country, just some issues that I see, and some things that we're able to help with too. So when it comes to chiropractic care, the reason I became a chiropractor and what gets me so excited is that as a chiropractor, we are working with the natural healing ability of the body. Chiropractic adjustments support the natural functioning of the body without any sort of invasive procedures or, foreign drugs or objects or things along those lines. We're able to remove the stress from your body so that your body can function to the best of its ability. In discussion of prenatal-specific chiropractic care, it's going to support pregnancy and birth as a natural process. And the 3 Ps will help us understand that here in just a few moments. But I want to just take a moment to acknowledge that women are literally designed to grow, birth, and nurture life. Nowadays in our mainstream medical system, we lose sight of that sometimes. We can treat pregnancy and birth as though it is a medical condition or something that warrants intervention, and sometimes that's the case, but more often than not, that's not the case. Women have been birthing in hospitals really since the early 1900s. It started to become more popular, but women have been birthing naturally without medical intervention since the beginning of time. So I want to mention this not to hate on, medical births or hospital births at all, because there can be really amazing hospital births, but I wanted to just take a moment to acknowledge this because oftentimes women who choose to birth naturally or women who choose to birth outside of the medical system can be villainized or even made to feel like they're being irresponsible or they're making a poor decision for themselves. But we have to remember women have been birthing that way since the beginning of time. So there are some concerns that not just myself, but other practitioners that work in the birth world have. And the first one that I want to discuss is C-sections and the really high rate of C-sections that we have in America. The World Health Organization states that a healthy percentage of C-sections for a given country is somewhere between 10 to 15%. However, the CDC reports that currently in America, we are 2 to 3 times higher than that. Our C-section rate now is 32.1%. So essentially 1 in 3 births are going to result in a C-section. And that number can be even higher amongst non-white populations. So there's a lot of different varieties that can come into factor. Sometimes it's just the provider you're working with. Sometimes that provider, they're not supporting their patient or they're not empowering their patient to trust their bodies and trust their innate ability to carry this baby and birth this baby, so that women may go in with some fear or feeling like they're not capable of doing so. Some other things that can result in C-sections are, believe it or not, side effects of common labor interventions like Pitocin or epidural. I have heard many stories from women who have experienced this themselves. Sometimes it is just a casual attitude about surgery or intervention from that practitioner. They may not think it's a big deal to have a C-section, but it may be a really big deal to that birthing mother. And unfortunately, sometimes it can also just be a matter of convenience to that practitioner. They may opt for a C-section to have the baby at a time that is catered to that practitioner's schedule versus being patient-centered. So obviously, these things can be really problematic. But the number one reason for unplanned C-sections in the US is failure to progress. So what failure to progress means is there is a lack of cervical dilation or lack of fetal descent. So either the cervix isn't getting big enough to birth the baby, or the baby's not positioning themselves optimally in the birth canal to be delivered vaginally. So when there is failure to progress, a lot of times there can be emotional or physiological blockages that mother is experiencing that's holding her back. She may not feel safe or heard in her environment. She may be fearful or anxious of the birth itself. Sometimes it's malpresentation of the baby, so the baby's not in a good position in order to be birthed. And sometimes there can even be an incompatibility between the size of the baby's head and the size of the mother's pelvis, but this is actually a lot less common than we are led to believe in America. So all in all, there are definitely some concerns around the high rates of C-section and why these C-sections are occurring. Another alarming statistic when it comes to birthing in America is that America has the number 1 highest rate maternal death in the entire developed world. So although we've made a lot of really great advances in medical technology and things along those lines, and they can absolutely be life-saving, I want to share this not to say anything negative about the hospital or the medical system, but to just raise awareness of the fact that it is flawed too. A lot of us are raised to believe that our medical doctors know everything and we're perfectly safe if we're at the hospital, but there are some risks that we need to be aware of. So in my opinion, these statistics are not okay. Again, we are very privileged in America, but we do need to understand where we are lacking within our healthcare system. And truthfully, starting with pregnancy and postpartum is a great place to begin and to begin to reform our healthcare, not just for the health of those mothers, although that is extremely important, but when we're better supporting our mothers during the perinatal period, that baby is going to benefit from it. Their future children will benefit from it. The family of that mother is going to benefit from it. Their community is going to benefit from it. And again, mothers tend to be the glue. So if we are taking better care of our mothers, we will be better taken care of as a community. So let's talk about how chiropractic care plays into this paradigm. Prenatal-specific chiropractic care is truly an essential and really underestimated part of cultivating a healthy and healing prenatal and postpartum experience. The 3 Ps we're about to discuss will help you understand the how and the why behind that. So before we talk about the 3 Ps specifically, I'm going to mention a term called dystocia. So the word dystocia means difficult birth. And Williams Obstetrics defines 3 different primary causes of dystocia. So this is where the 3 Ps are going to come into play. In terms of dystocia or difficult birth, the first primary cause is going to be inadequate function of the uterus or issues with the power of the uterus, so the first P. The second primary cause of dystocia or difficult birth is pelvic imbalance or issues with the passage that the baby is birthed through. And last but not least, number 3 primary cause of dystocia or difficult birth is baby malposition or issues with the passenger, aka the baby. So let's talk about how chiropractic care factors into this. So first primary cause of dystocia or difficult birth is power. So inadequate function of the uterus. What this means is that the nerve supply to the uterus is not functioning properly. A way I explain this to my patients is it's kind of like poor cell phone reception between the brain and the body. So some of the signals are getting through from the brain to the uterus and vice versa, but not as well as it could be. When the uterus isn't getting proper nerve supply, this impacts the uterus's ability to contract, and we've got to have those contractions in order to be able to push that baby out. So where chiropractic care comes in to address the power of the uterus is because chiropractic adjustments reduce nerve interference. They take stress off the nervous system and essentially reconnect the brain and the body. And this allows the uterus to function optimally, which again, the goal here is for the uterus to contract well so we can push the baby out. So number 1, power. The number 2 cause of dystocia or difficult birth is passage. Now, when there's issues with passage, what this means is there is a lack of motion in the pelvis. This reduces the diameter of the pelvis, and this means less room for the baby to move through the birth canal as they make their entrance into this world. How chiropractic care is going to come into this is chiropractic adjustments restore motion to the pelvis, and this allows for optimal space inside the pelvis. When there's better movement, when there's more room, baby can more easily get through the birth canal and be delivered vaginally. Number 3 cause of dystocia, so our last P here, is going to be passenger. When there is an issue with passenger that's causing difficult birth or dystocia, this is due to an imbalance in the mother's pelvis, which will cause tension and torsion on the uterus. And this can really restrict the baby's ability to optimally position themselves for birth. Oftentimes, this is where we see a breech presentation. where chiropractic care is going to come into things is Webster prenatal-specific adjustments. So the technique we were discussing, these adjustments gently restore proper balance to the mom's pelvic bones, the muscles, the ligaments. And when we have better balance in the pelvis, this creates more space and more room for baby to position themselves and get themselves in an ideal spot for birth. So to sum up those 3 P's, the first one is power, so nerve supply to the uterus, which allows the uterus to contract and push the baby out. Number 2 is passage, so ensuring proper balance and biomechanics of the pelvis so that the baby can safely make it through the birth canal. And then the third, which is passenger. So again, ensuring proper balance of the mother's pelvis so that baby has the room to be able to ideally position themselves for birth. So the goal is not to flip babies directly because we don't work in the field of obstetrics specifically, but we often find that when we are restoring proper nerve, proper spine, and proper pelvic balance, baby tends to position themselves in a way that is conducive to a natural vaginal birth. So before I start working with any mother and before we start working on those 3 P's, we will always start with a new patient exam and history. When we go through this allows me to really hone in on what the mother's physical, mental, and emotional and chemical stressors are that can be contributing to symptoms you're dealing with in pregnancy, or things that could potentially become a roadblock when it comes to their birthing experience. When we get them going with care and when we're doing the Webster technique, not only are we adjusting the spine and the pelvis through those bony joints, we're also addressing the round ligament, we're addressing the hip flexors, and also some other really important soft tissue structures that attach to the uterus and to the pelvis. In addition to chiropractic adjustments, I mentor my prenatal patients on healthy ways to move their body and support alignment and balance in their body on a day-to-day basis so they can feel better during their pregnancy, but also so that they can prepare themselves for birth. And I just want to thank you guys for taking the evening to listen to this topic. This is something I'm really, really passionate about. I truly, really love working with moms. I think it's really special to be able to kind of tag along on that prenatal journey and help those moms experience the best pregnancy, the best labor and delivery, and the best postpartum experience they possibly can, because our mothers deserve that. Our children deserve that, and our future generations deserve that. So if you know someone who is currently expecting, or maybe they plan to in the future, maybe they're prioritizing a natural birth, maybe they're not. If you know any mothers like that and they're local to the Flathead Valley, please send them my way. I would love to help them. If you know somebody that doesn't live in the Flathead Valley that needs this type of care and support during their perinatal experience, please do not hesitate to reach out. We would love to get you in contact with somebody who does a lot of this same work too. Because again, our mothers deserve this support. So thank you so much for joining tonight. Join us next week. Dr. Ryan will be talking about the safety pin cycle. So he'll be talking a lot about brain-body connection, and this will apply to everybody, not just moms. So thanks for joining tonight. We'll see you next week.